When did your symptom first start?
They're starting in 2009.
Okay, so about 2.5 years ago?
2.5 years ago.
Okay, and what symptoms did you develop?
Well, let me...
Oh
yeah, well, I have a red eyes, and it is itchy and red eyes in the beginning, and after that I will feel my eyes, it's really hurt, and after the next day I heard my body's going down, and I thought it's a red, the pink eyes in the beginning, and after that, well, day after day I wait, I say, okay, maybe I'll feel better, but actually I feel bad every single day.
So you've been feeling bad now for 2.5 years,
2.5 years,
and the vision has been poor, and you've seen a couple of doctors, and has anybody been able to give you a diagnosis?
No.
No.
Nobody's been able to give you a diagnosis.
No. Even when she was admitted at the hospital at the time of her infection, when she had what they said it was a bacterial infection, but they weren't able to give her a hard diagnosis. They took cultures from her eyes. At the time when she had the infection, she had some yellow, whitish discharge from her eyes. They took cultures. They were never able to find anything. And
how long was she in the hospital?
It's about 5 days.
5 days in the hospital.
5 days.
Nowadays, that's pretty hard. You got to be pretty sick to be in the hospital 5 days.
Yeah.
And still no diagnosis.
No diagnosis.
They give me couple of kind of antibiotics.
They had like 3, power antibiotics on IVs for the whole 3 or 4 days that she was there. And even after that, there was no diagnosis. After the follow-up, she followed up with an ophthalmologist that the hospital had arranged for her to see. And for 2 years after that, nothing. I mean, he had given her eye drops, but...
A lot of antibiotic drops and everything.
Right.
Yeah.
Steroid eye drops.
And then how'd you get to me?
I did some research online.
Okay, you went to the Google.
I went to the Google, and I Googled, cornea specialist, because, we had, her doctor had told us that this was she had cornea scarring, and the problem was in her cornea.
And he can't do anything. He didn't do anything for me. And every time I go to him, he asked me to come in next week. And the next week, he said, oh, well, you're fine. You can come in the next week. In 2 years, 2.5 years, I'm going every single week to him, and I feel bad and bad and bad.
There was no end to it. It was just dragging on and on. So I did some research online, and a few things popped up, and DukeEyeSurgery popped up, and your name, Dr. Alice Carlson, popped up, and I just kind of read more about this eye center, about DukeEyeSurgery, and
how's your experience being at Duke so far?
Great. Well, from the first visit, it's
how long did it take me to make the diagnosis?
Just one visit.
Just one visit.
How many minutes did it take for me to look at you?
3 minutes.
2 minutes. I mean, I think you had, you had something in mind, and the blood work confirmed it.
Yeah.
The tests confirmed it. So.
Well, actually, I tell everyone, since you looking in my eyes, you know what I have.
It took about 2.
It's like a magic.
It was pretty clear cut from your history. Even before I looked at you, I kind of knew what I was going to probably see. And when I looked at you, I immediately knew what it was.
Exactly. You know what I have. And the first minute you look into my eyes, you know what I have.
And this has been going on for 2.5 years, and nobody was able to.
Nobody knows what I have since you just look into my eyes, you know.
Or even like make more tests, or for her to have more tests to see if it could be something.
Yeah.
But I think everybody just had assumptions, and they just wanted to.
I appreciate you to do that, because I can't believe somebody one day they know what's wrong with my body.
Yeah, and we've diagnosed it so that we know what. We've tied it all in, and we've connected all the dots, so we know exactly what you have.
It's very quick.
Yeah.
And my vision go back as like a normal. I can't believe that.
So you're a lot better now on the new medicine.
A lot better. Yeah,
Excellent.
you can't believe how I feel now. Before I feel so bad, I feel myself, I want to die when I can't see anything, but now I feel much, much, much better. I can drive, I can see, I can go to work, I can do everything. I can't believe that.
Oh, excellent.
Yeah.
All right, well, anything else you want to tell me? Anything else?
I want to say really thank you so much, and
thank you for coming to Duke.
And we will be coming here for future visits, and I will be recommending this center to
of course,
to my colleagues and to people that we know.
Thanks very much.
Well,
I appreciate
everybody, you do a really good job. I can believe that.
All right, thanks. Appreciate it.
Thank you so much, Doctor. Thank you.